Hypertension or high blood pressure is when our blood pressure rises to levels that are above normal. But how can you tell when it's a real issue?
Here to discuss is Dr. Girish Dilot with Intermountain Health. Good morning, doctor.
Good morning.
Well, let's dive right in. Let's talk about what high blood pressure is.
Well, high blood pressure is when your blood pressure is running high. And the basic definition of high blood pressure for patients and people over the age of 60 is 150/90. And for people under the age of 60, it's 140/90. But our goal is to get everybody's blood pressure under 140/90. The basic definition is when the pressure that the heart's pumping against the walls of the blood vessels in the body.
For the average person, what are the kind of symptoms, or are there symptoms that they should look out for?
Unfortunately, there's not many warning signs or symptoms of high blood pressure. You can have high blood pressure for many years, and sometimes the first sign or symptom you have is when you've had an event, such as a heart attack or a stroke. So that's why it's really important to preventative care and have your blood pressure monitored as you're getting older.
Now, we understand that there are, high blood pressure medications. Is there any other ways to treat it without medication?
Yeah, there are ways to prevent high blood pressure from developing, healthy lifestyle, decreasing salt intake, decreasing your alcohol consumption. If you're a smoker, to quit smoking. All these things can go a long ways in really preventing high blood pressure.
Is it, can it be a hereditary thing? Is it something that can just creep up on someone?
It's really hard. There's no specific hereditary genes that they've isolated. It can creep up on anyone. And whether or not you have the risk factors or not, you can have high blood pressure.
Now, is it just about sort of maintaining your lifestyle in a way, or are there other ways to prevent it?
No, there are, as I mentioned, there are other ways to prevent it. Again, eating a healthier meal, avoiding fast food, food with less salt, exercising, taking that walk after dinner. All those things can go a long way in really controlling your blood pressure or even preventing high blood pressure.
Obviously, we talked about exercise and lifestyle, but things like, regulating your sleep, making sure, you have time to relax, those are important aspects too, right?
Absolutely, because anxiety and stress definitely play a role in high blood pressure. We have a lot of patients that come to our office, their pressure is high, we check their blood pressure a few more times, and after they relax, their pressure comes down. So definitely sleep, stress play a big role
now, you
in high
mentioned
blood pressure.
There aren't really many symptoms or sort of indicators that someone has high blood pressure. So what should be the first thing if they suspect, or is it just doing your normal checkups?
I think after the age of 18, they recommend getting a blood pressure check every 1 to 3 years. And over the age of 40, you should definitely get a full physical and get your blood pressure checked on an annual basis.
Okay, clearly you're an expert on this. How can people reach out to you? How can they contact you? What's the best way of going about this?
Well, the best way is to really consult with your primary care physician. If you don't have one, Intermountain is accepting new patients at more than 30 locations. The Medicare enrollment period is coming up, and that's a good time to evaluate your primary care provider team and your insurance coverage to make sure you get the best healthcare going forward.
Right. And one other quick thing, people have Fitbits and stuff now. So I mean, if people are worried about having to take a trip to go and see a doctor, you can monitor yourself, right? You can make sure, you can fill in yourself whether you feel well or not, or whether your blood pressure is, or your heart rate's starting to increase, those kind of things.
Absolutely. I mean, I think these Fitbits can play a good role in monitoring blood pressure and pulse, but it's important to get a full checkup.
Right.
And before we go, talk to us a little bit about that importance to when it comes to high blood pressure, maybe some of the risks, factors involved with that.
Absolutely. I mean, high blood pressure uncontrolled over time can lead to heart attacks, heart disease, stroke, damage to the eye, and kidney disease. All these things can definitely impair one's health and lead to some serious issues.
Well, that's a reminder for everyone to make sure they take care of themselves, they get checked up, they come and visit someone like you and make sure they prevent it before something terrible actually happens. So if you need more information, go to intermountainnv.org.